Everyday occurrence. The tiny infants you see here at University Hospital are typical of the thousands in other hospitals across the country. But how each is delivered is another story. Most were delivered vaginally, as is the most common method. Others, however, were delivered by cesarean section. One Columbus couple, George and Andrea Lynch, wanted to share the cesarean birth of their child with you.
By viewing how positive a cesarean birth can actually be, that a lot of the negative feelings that are associated with cesarean deliveries can be eliminated, and hopefully hospital policies and doctors and different people that are associated with cesarean deliveries can also benefit, and see what their patients' needs are.
I asked Andrea's obstetrician and gynecologist, Dr. Frank Isabel, to explain just what a cesarean section is and why a mother-to-be would need it.
Probably the most common cause for a cesarean section is just repeat cesarean sections that were done before for other indications. And for those patients, the most common causes of cesarean sections are an inability to deliver an infant who may be too large for for a mother's pelvis. Also, we'll see an increase in cesarean section for women who have high blood pressure and for problems that may occur during their labor, and for patients who are diabetic, certain classifications of diabetics. And of course, there is a number of cesarean sections that are done, for example, for infants who are presenting in a certain types of breech, which means coming down butt first or feet first.
Now, there's been some recent reports of the increased number of cesarean sections in the Columbus area as well as on the national level. Can you tell us why, as well as what kind of an increase we're looking at?
Yes, we have seen a slight increase in cesarean section births in this area, primarily due to the fact, I think, that we're paying more attention to the infant at this time. I think that we try to obtain better infants. And if we have any difficulties with the labor, rather than allow them to progress, many people are suggesting that we can obtain a better infant by doing cesarean section.
How important has the doctor-patient relationship been for you?
Okay, that I think is probably the most important, because you have to have a lot of faith in your doctor, first of all. And I think that most doctors are fairly flexible, so that if you gain knowledge through classes such as Case Lamaze offers, and reading and things like that, that you can present your views to your doctor, and hopefully you will keep, as a patient, keep your mind as open as you expect your doctor to keep his mind as open of your views.
Andrea's cesarean section was scheduled for a Wednesday morning. On the Tuesday morning before, she underwent an ultrasound and amniocentesis treatment. Dr. Lawrence Stemple, who performed the ultrasound, explains.
Probably the foremost reason is for the determination of fetal age. Many women have uncertain menstrual dates, and it's very important to know when the baby is due in most pregnancies. And ultrasound is the easiest and most accurate way of determining when the baby's due. We're in the region of the baby's head, and as we move up from the baby's head, we're in the baby's chest region, and we can see very clearly the baby's heart beating. The heart is beating at approximately 140 times per minute, and we can just see the valves in the baby's heart beating. Okay, right now we're down in the region right below the bladder, or just below the bladder, and we can see what appear to be male genitalia, and they're pretty much in the middle of the screen towards the right, and it's right in the region between where the legs come off. It's very likely that this will turn out to be a male. You can never say with 100% certainty, but it's very likely that this will be a male.
Following the ultrasound, Dr. Isabel performed the amniocentesis.
Amniocentesis is a procedure where we're able to obtain information by studying the amniotic fluid, that fluid that the baby floats in during pregnancy. The information we wanted, particularly in Andrea's case, is we wanted to know if the infant's lungs were mature enough to sustain life outside of the uterus. And this is called measuring chemical components in the urine called lecithin and sphingomyelin. But amniocentesis is done also for other reasons. It's done for genetic purposes, for example, to determine if there's any chromosomal disease that can be picked up. Also, certain chemicals can be picked up in the amniotic fluid that would tell us of a hereditary disease with certain kinds of patients.
After results of the amniocentesis were learned, Andrea was admitted to the hospital later in the day and scheduled for surgery the next morning. The operating room was small, but the team of 4 doctors and 3 nurses worked efficiently and effectively. Also in the room is Andrea's husband, George.
I feel the need for support of my husband since the 2 of us were involved in conceiving the baby. The baby's an outcome of our love for each other, and it's a sharing experience, and to eliminate the father from it seems to me to be like cutting your arm off or something, you know. And I also feel they've stressed bonding with infants and mothers, and I think it's very important nowadays, especially with the problems marriages seem to have, that the bonding between the 2 parents from the birth experience comes about.
Andrea remains awake through the birth to share it with her husband. Consequently, she has a spinal anesthetic, as anesthesiologist Dr. John McDonald explains.
Make a few little marks on your back now. Hope you aren't too ticklish. Try to keep your back pushed right out to me. That's perfect. You're doing beautifully. How do you feel?
Okay.
Okay, now you're going to feel a little pressure like I talked to you about yesterday, right? Mm-hmm. You mainly feel the pressure of my hand back here. Okay. Just a little bit of pressure now. Just try to relax and push your back right out to me, just like you're doing. You're doing perfectly. And try not to move. It's very important you don't move right now. So we're all finished. That's that little thud. Now don't move. We're all finished. That was that little thud I told you about, and we're all done.
Is it okay if I tensed up?
You did just great. You did perfectly.
The operation itself takes approximately 45 minutes. Dr. Isabel explains the main points.
Andrea? Okay, you can just relax and just breathe easy, and everything has gone along quite fine. Just making my skin incision here, okay? Deep knife, please. No, maybe not. Okay, we'll just get that on the way out. Now
Are
I'm
you
just,
happy so far, Dr.?
oh yeah, just incising down to the fascia
Blood pressure
at this time.
change.
Just increase the size of my incision here. Finger underneath. Okay, let's go in this direction. I'm looking right at your baby here.
You have to suck it.
It's absolutely beautiful. Okay, bladder blade out, please.
Now this will be the pressure, the real deep pressure sensation. Like
I have my hand on the baby's head. I'm going to guide it out through the incision as Dr. Stemple gives me a little pressure on the abdomen. There comes just a beautiful, beautiful baby. Yeah, the sucker there, Dr. Stemple?
Okay, Dr. Smith.
I can't tell you what it is yet. We don't have it all the way out.
I want Dr. Smith.
Okay, my reputation's on the line here.
Dr. Stemple's reputation's on the line. Okay.
So he gets to tell me.
Okay, a little more pressure there.
And it's a
Okay, a little suck.
boy.
It's a beautiful, beautiful baby boy. Unbelievable.
Can you hear him? Doesn't he sound nice?
Okay. Okay, you can cut that, another cord clamp on there and cut, please. Okay, it's a boy. George, congratulations. Now I'm going to have the pediatrician check the baby, and then we're going to give the baby to you. Very good. Okay.
Following the delivery, Dr. Isabel explains what happens to the baby.
The infant is given to the pediatrician. He takes it over to a warmer, and he'll do a very thorough and quick assessment of the infant. He'll give generally speaking, a physical examination to the infant to make sure the infant is okay. This does not take very long, perhaps 5 to 10 minutes for him to do this if everything goes along, as in Andrea's case, a planned cesarean section and a planned delivery without much difficulty, but because generally speaking the infants do quite well. In an emergency, of course, this may vary somewhat. But let's take Andrea's case. The pediatrician will look over and give the assessment of the infant, and as soon as the infant is determined to be fine and in good shape, which we anticipate, then the infant will be given to the mother. The incision just looks absolutely, absolutely gorgeous. The purpose of the benzoin is just to allow the stereostrips to stick a little more. We really don't need all that. I'll sort of blot some of this up. Andrea, as you probably know, whenever I deliver a baby, I always shake the father's hands and I always kiss the mother's. Congratulations, Steve. You're welcome.
That was really, really surprisingly comfortable. I can't believe it.
Well, that's what we want it to be.
I know, but I mean, I can't believe it because
Definitely want it to be comfortable.
Andrea is then taken to the recovery room and shortly thereafter is able to nurse her newborn.
It was probably one of the most exciting moments in my life. I can't, it was just wonderful. It really was. And the look in my husband's eyes when he watched the baby being born was just unbelievable.
I feel the same way. The fact that I got to see my baby being born after the first time when I just guessed what had happened and didn't get to see my wife or my baby for a long period of time. And all the good work that was done by the professional people is made up for, all the bad experience I had with my first childbirth. But this one has really been a good experience, one I won't ever forget.
Thank you both very much.